Okay. All right, I apologize. I have that a little misworded. Fetal alcohol syndrome in itself is not necessarily a genetic disorder. This is a problem that is unfortunately being ignored in the Texas foster care system and law enforcement in Bexar County. Now, I do understand, because I know a lot of attorneys and judges who have told me that the Supreme Court has basically said that it's kind of bad law to arrest a mom for using drugs while pregnant, okay? However, it does happen. Bexar County is not one of the counties that tends to pursue these types of cases. However, probably 75 to 80% of my practice are children who have been exposed to drugs in utero. It's very sad what it does to these children. Even if they don't have severe problems later on, or even initially, the chance and the likelihood that they're going to have social problems and ADHD later on are pretty high. So if anybody's doing any kind of advocacy work, please start advocating for some changes in the way we look at this issue. Because unfortunately, what's happening to a lot of these mothers is they will have these babies. They use a variety of drugs, by the way. They get out of the hospital, CPS takes their baby, they relinquish their rights, and 10 months later they have another baby. Drug positive. I have 2 little guys right now, twins. They're 6 years old. They're this tall. Dwarfism, severe. I've talked to their medical doctor as well recently, and she's very concerned about this situation too. Mom wants the babies back now. And part of this is because our system is not entertaining the idea that these mothers need to be incarcerated. If this child had been born and the mother had hid it, they put her under the jail. I don't see the difference. I think so too, yes. Absolutely. I would have no problem with that at all, because they allowed it to happen. In Texas, it's called crime by omission. Yeah. So this is definitely a problem that deserves more attention, treatment, and research. Post-traumatic stress disorder, reactive attachment disorder, disinhibited social engagement disorder are all potentially exacerbated by these problems. And I use the word potentially because, of course, I can't say for sure, but I would say 99% of the time it exasperates. Okay? The possibility these diagnoses coexist with fetal alcohol syndrome or other genetic damage has tremendous implications for the effective treatment of these disorders. Because sometimes it's something else needs to be done. There are potentially medical treatments that, if this is caught early, can help the baby. Now, one of the reasons I'm bringing this up is I get lots and lots and lots of cases where that CPS will call me, and the child's maybe about 1, 2 years old, and they'll say, can you do a developmental assessment for us? Let us know how the baby's doing, what recommendations you would make right now, etc. Well, I go in, I start checking the baby's medical history and the legal history, and I talk to the caseworker, and I say, hey, mom drank during pregnancy. By the way, it only takes 1 ounce of alcohol to harm a fetus. Mom drank during pregnancy. Has anybody had this child evaluated for fetal alcohol? No. Mom used cocaine during pregnancy or marijuana, which, by the way, and meth also. Those 3 have been shown to cause genetic abnormalities in adults. Imagine what that can be doing to a fetus. I had a case just this year where mom had used cocaine during pregnancy, and Dr. Fierro, who's a wonderful developmental pediatrician here, actually took the bold step of saying the child has a form of fetal alcohol syndrome and genetic damage. It's very unusual I see that, but if we get them in time, maybe we can get it. Now, one of the other problems with, oh, that button's part of my problem. Okay. One of the problems with fetal alcohol syndrome is this. Anybody that's interested in doing some more research on this, if you go onto the CDC website, there's actually an entire program on there that you can actually receive training in to be able to give it concerning fetal alcohol syndrome. And one of the things that happened when I was reading through that information, it said that now, because of the controversy about fetal alcohol syndrome, there are only 3 diagnostic criteria basically that the doctors are looking at, and it's pretty restrictive. So I don't know if that's going to be changing anytime in the near future, but if you're interested in more research about that, it's on cdc.gov, and I think I just searched fetal alcohol syndrome. But it's an entire program. You can download it into your computer. It's all free. Thank you very much for your time and attention. It was a pleasure to give this to you, and I'll turn this back over to Mike.